Hello, thank you for visiting KK Women's and Children's Hospital. Your child has been diagnosed with pneumonia. We have put together this video to help you better understand this condition and the expected course of treatment, how to care for your child, and when to seek medical attention. What is pneumonia? Pneumonia refers to an infection of the lung. The infection is usually caused by viruses, but can also be caused by bacteria or other germs. What are the symptoms of pneumonia? Children with pneumonia usually present with fever, cough, and difficulty in breathing. They may appear tired, unwell, and may not eat and drink as usual. Sometimes they may also have other symptoms like chest pain, nausea, or vomiting. How is pneumonia diagnosed? Doctor will gather information about your child's condition and examine your child. In most cases, a chest X-ray will be done to confirm the diagnosis. Additional tests may be required if your child requires a hospital admission. How do we treat pneumonia with mild symptoms? If the pneumonia is mild and your child is stable, a hospital admission may not be required. Drink plenty of fluids to stay well hydrated and rest at home. Do not return to school until the fever has resolved and the cough is not causing too much discomfort. Your child may be given a course of oral antibiotics if bacterial infection is suspected. Your child should complete the entire course of antibiotics even if he or she appears well. If the antibiotics are stopped too soon, your child's lungs may continue to harbor bacteria that can multiply and cause the pneumonia to recur or develop complications. Medications to suppress the cough are not routinely indicated for treating children with pneumonia, because coughing helps loosen and move phlegm from the lungs. It is a good idea not to stop the cough completely. Young children may not be able to cough out the phlegm. They usually cough and swallow it. Medications to loosen the phlegm may sometimes be given to help loosen and clear thick secretions from the air passages. This may increase coughing initially to expel the phlegm. Such medications are not recommended for children under the age of 2, as the child's ability to cough out the phlegm may be limited, which may lead to obstruction of breathing tubes by retained phlegm. As the infection improves, fever will settle down and the child will start feeling generally better, though the cough may last up to 2 weeks or more. When do we need to admit the child? Your child will need to be hospitalized if he or she is very unwell, has low oxygen levels, difficulty in breathing, poor feeding, or persistent vomiting. Your child will be closely monitored and given antibiotics if bacterial infection is suspected. Adequate fluids as well as fever medications will be given. What are the potential complications? Most children with pneumonia will get better with treatment. Sometimes, despite appropriate treatment, complications may develop. Persistence of symptoms such as high fever and difficulty in breathing despite treatment may suggest possible development of such complications. Complications include bacteria entering the bloodstream and spreading to other organs in those with pneumonia caused by bacteria. Fluid collection inside the chest in the space that surrounds the lung, known as pleural effusion. Pus collection within the lung, known as lung abscess. Lung collapse caused by phlegm blocking the air passages. If complications are suspected, a repeat chest X-ray, an ultrasound, or CT scan of the chest will be required to confirm this and plan further management. Is follow-up required? Your child may be given a follow-up appointment for review by a doctor at the specialist clinic, polyclinic, or general practitioner. Keep the appointment as advised by your doctor. How can we prevent pneumonia? Ensure that your child has completed vaccinations, including vaccination against the bacteria called pneumococcus. Flu vaccine, which is given once a year, may also help. Maintaining good hand hygiene and avoiding exposure to tobacco smoke will be helpful. A healthy diet, regular exercise, and good sleep will help improve the immune system and hence reduce the risk of developing pneumonia. What to look out for upon discharge? While on treatment at home, watch for persistent high fever, poor feeding, difficulty in breathing, or chest pain. Please return to the Children's Emergency for a review if your child has any of these symptoms. Please scan this QR code to access the KKH Urgent Pediatric Advice Line UPEL for further advice. Please approach our doctors if you have any enquiries. Thank you.